Chapter 6, Part 2. Managing the environment to prevent the spread of bacteria. The first step in maintaining the environmental integrity is to control the traffic that enters and passes through the CS department. The aforementioned dress codes apply to all who enter the CS department. Department dress standards for visitors, such as sales representatives, maintenance personnel, and clinical engineering staff, vary between facilities. In some facilities, they must change into surgical scrubs. In others, coveralls worn over the street clothes are required. CS technicians must protect the integrity of the environment by enforcing traffic control guidelines. This may sometimes mean educating visitors about dress code and traffic protocol. Dress code requirements may change as CS technicians move from one area to another. For example, surgical scrubs and hair coverings may be appropriate for the clean assembly area, but OSHA required PPE is necessary for the decontamination area. See Figure 6.9 as an example. Dress codes are as important part of traffic as traffic control. Therefore, CS technicians must understand what attire is appropriate in different areas. Note, if in an unfamiliar area and you're unsure of the attire requirements, ask before entering. Areas that CS technicians routinely travel through may have 3 separate traffic control dress code requirements. Restricted. 1. Restricted requirements are where sterile surgical procedures are performed. Surgical scrub attire, hair coverings, and masks are required in restricted areas. Those working within the sterile field, including surgeons, surgical technologists, and nurses, are also required to wear a sterile surgical gown and gloves. Note, semi-restricted areas in the operating room, such as access corridors to surgical suites, must follow restricted dress code. 2. Semi-restricted. These are areas include peripheral support areas to the operating room and central sterile clean assembly, and sterile storage areas. Surgical scrub attire and hair coverings are required in this area. Finally, unrestricted. These areas include normal traffic areas such as hospital corridors, most offices, locker rooms, and general public areas. The cafeteria and waiting room are examples. Street clothes may be worn in unrestricted areas. Central service departments use signage to assist in the traffic control. All restricted and semi-restricted areas also have signage that informs people entering the area about the need for specific dress codes. See Figure 610 for an example. Occupational Safety and Health Administration, 29 CFR 1910.1030. OSHA, the Occupational Safety and Hazard Administration, is the primary federal agency charged with the enforcement of occupational safety and health legislation. In response to concerns, OSHA published the Blood-Borne pathogen standards recognizing the potential for occupational exposure to blood-borne diseases such as hepatitis B, hepatitis C, and HIV. The standard places the responsibility for providing a safe work environment on the employer and contains several key elements. The following are the key elements. A written exposure control plan, ECP, that summarizes the employer's program for the protection of workers from occupational exposure to blood-borne diseases. The ECP must be reviewed annually and updated whenever new tasks or procedures affecting occupational exposure are instituted. An ECP contains the following provisions: determination of employee exposure, implementation of various methods of exposure control, including standard precautions, also known as universal precautions, engineering and work practice controls, which is the use of engineering controls to physically remove the hazard, and develop of work practice controls such as policy and procedures to prevent occupational exposure and transmission of blood-borne pathogens. Use of PPE is another example. Also, housekeeping, which is the provision of a clean and sanitary working environment, including scheduled cleaning and using hospital germicides or disinfectants approved by the U.S. Environmental Protection Agency, or the EPA. Also, hepatitis B vaccinations. The facility must offer the hepatitis B vaccine at no cost. Employees who choose not to take the vaccine must sign a declination or refusal form, and they may reconsider at any time during their employment. Also, post-exposure evaluation and follow-up. A provision for medical evaluation and treatment when an employee experiences an exposure incident. Another is communication of hazards to employees and training regarding those hazards. Record keeping, proof of training upon initial hire and annually thereafter. If significant changes are made to the ECP, additional training is required to address the changes. Medical records regarding any exposure must be maintained. Procedures for evaluating circumstances surrounding an exposure incident. Also, the use of fluorescent orange, red biohazard signs and labels to identify contaminated items of regulated waste, and they may be stored or transported in refrigerators, freezers, and other containers. See figures of these labels and signs in items 611, and labels that are not required when using red bags or marked containers. As an example is in 612. Finally, disposal of all sharp-in items in rigid puncture-proof containers that are covered properly, labeled, or color-coded. See an example of a sharps container in 613. Reusable sharps should be transported and enclosed in carts or hard-sided containers to prevent injury, and an example of this is in 614. That is an entire list of the Occupational Safety and Health Administration enforcements. Environmental concerns in central service areas. In addition to specific guidelines for dress codes and standard precautions, there are environmental tools designed to help CS technicians promote infection control. Some tools are evident, others, while not as evident, still play an important role in maintaining an environment that is safe for patients and employees. Physical design. CS department's physical design should incorporate a clear separation of clean and dirty, and workflow patterns should not be designed that create a one-way flow of goods from dirty to clean. In addition to walls separating the decontamination area from the rest of the department, the area is designed to reduce the likelihood that airborne bacteria can be transmitted from the decontamination area to the clean area. This is accomplished with the use of positive and negative air pressure. The decontamination area has negative, lesser air pressure. This means that when a door or window is open between the separate work areas, air flows from the clean, positive pressure area to the dirty, negative pressure area. This minimizes the risk of airborne bacteria in the decontamination area being carried to clean the area. Figure 615 illustrates the airflow created by the use of positive and negative air pressure. To maintain the balance necessary for air pressure systems to function correctly, windows and doors between the decontamination and clean areas must remain closed when not in use. In addition to air pressure requirements, central service areas must be meet specific temperature, humidity, and air exchange requirements. These vary by work area, and central sterile technicians must be familiar with the requirements for each specific area and ensure that policies designed to manage airflow, temperature, and humidity are followed at all times. In many departments, CS technicians may be responsible for collecting data, such as temperatures and humidity, and recording that data as a part of their department's formal decontamination system. Figure 616 provides temperature, humidity, and air exchange requirements for CS work areas. Figure 616 breaks down the work areas, temperature, humidity, and air exchanges for each. Work cleanliness. The cleaner the work area, the more likely that the products prepared in CS will be safe for use in a sterile environment. Dust and lint particles not only carry bacteria, but in some cases, lint remaining in a sterile set may enter the patient's body during surgery and cause infection. CS technicians must minimize the amount of contaminants such as dust, lint, and bacteria in these work areas. Bacteria can be transmitted by contact with contaminated items. Items in the decontamination and clean assembly areas can also be contaminated, which may be transmitted to other objects. Inanimate objects that can transmit bacteria are called fomites. Common fomites that become contaminated in CS areas include door handles, computer pads and keyboards, telephones, work surfaces, and other items routinely handled by multiple people. CS technicians should know that by routinely cleaning these items and their general work areas, workstations, they can control the unwanted spread of bacteria within their workplace. Definition: fomite, an inanimate object that can transmit bacteria, such as a pen. Food and beverages should not be allowed in CS work areas. This standard is well understood for decontamination areas. However, this rule is also necessary in clean areas of the department for the following reasons. Beverages should not be allowed because they may spill and contaminate sterile items, or they may spill onto items that need to be sterilized and impact sterilization outcomes. Spilling may also contaminate items being assembled for sterilization or damage count sheets, reference books, and other items on the workstation. Foods should not be allowed because it may also contaminate items. CS technicians should not eat food in their work areas because their hands may become soiled and they can transmit bacteria. Snack foods leave oily residue on hands that can adhere to instruments being packed for sterilization. This oil may impede the contact of the sterilant with the entire surface of the instrument. Food and beverages also attract insects and may increase the chance of insects invading the work area. Environmental cleaning, or housekeeping, is a vital component in the department's overall infection prevention and control process. CS departments are routinely cleaned to ensure that the microbial population is minimized. Basic housekeeping procedures used in CS should be the same as those used in the OR and delivery room areas. Cleaning guidelines include the following. Floors should be clean, wet mopped at least daily. Floors should never be swept or dust mopped because dust will rise and fall on items such as instruments in the area. When sterile packages are opened, the dust that has accumulated on them may fall onto the package contents. The decontamination area should have separate and dedicated cleaning equipment, such as mops and buckets. Items used to clean contamination areas should not be used elsewhere. Horizontal work surfaces, such as counters and work tables, should be cleaned at least daily and preferably every shift. Light fixtures or their covers and air vents should be cleaned at least every 6 months or as necessary. This function is usually performed by another department such as environmental services or plant maintenance. Finally, other surfaces including walls, cabinets, and racks should be cleaned on a regular scheduled basis. Many CS housekeeping functions are performed by environmental service personnel. However, routine cleaning of sterile storage cabinets, carts, and racks is usually the responsibility of CS technicians who have been trained to properly handle sterile items and who know specific product names and locations. Other environmental cleaning requirements. Fixtures and furniture in the CS departments must be constructed of materials that may be washed, and they must be cleaned on regularly scheduled basis. The area designated for sterile storage may consist of either open rack or closed cabinet storage units. The decision about the type of storage used is based on the types of items to be stored and the amount of traffic in that area. For example, closed cabinets may be used in high traffic areas, and open shelving racks may be used in more controlled low traffic areas. Open rack systems should have a solid bottom, so items stored on the lower shelves are protected from contamination during housekeeping tasks. Note: specific information about sterile storage will be covered later in Chapter 16. CS technicians work with items at all stages of the decontamination, sterilization, storage, and distribution process, so they must be well versed in basic infection control principles. To ensure the workflow is maintained and items are handled appropriately at each stage in the processing cycle, staff must understand and practice the principles of asepsis. An important concern. As discussed in Chapter 4, some microorganisms are becoming resistant to antibiotics or are naturally very hard to control. Many of these resistant microorganisms can be transferred to other surfaces and people very easily. Controlling these microorganisms and preventing their transmission is the #1 responsibility of the CS department. Understanding the way microorganisms can be transmitted is the key to helping stop cross-contamination. Elements of transmission in the chain of infection. Infection transmission is a complicated process that involves many factors in order for the pathogenic microorganism to result in disease or illness. According to the Center for Disease Control Guideline for Isolation Precautions Preventing Transmission of Infectious Agents in Healthcare Settings, 2007, a document, the transmission of infectious agents in a healthcare setting requires 6 elements: a causative agent, a reservoir, a portal of exit, a mode of transmission, a portal of entry, and a susceptible host. This infection disease process is better known as the chain of infection. You can see Figure 617 for a description and explanation of the chain of infection. Definitions: causative agent, chain of infection, the microorganism that is causing an infectious disease or causes an infectious disease. Reservoir in the chain of infection, the path by which an infectious agent leaves the reservoir. Portal of exit, the path by which an infectious agent Reservoir is as follows: the place where an infectious agent can survive. Then the portal of exit is the path by which an infectious agent leaves the reservoir. Mode of transition, number 4. The method of transfer of an infectious agent from the reservoir to a susceptible host. Portal of entry, the path used by an infectious agent to enter a susceptible host. And finally, a susceptible host, a person or animal that lacks the ability to resist infection by an infectious agent. Each one of these 6, causative agent, reservoir, portal of exit, mode of transmission, portal of entry, susceptible host, are elements in the chain of infection. Let's go into detail on chain of infection in the 6 elements. Causative agent, number 1. The first link is the causative agent, meaning the pathogenic microorganism, which is a bacteria, a virus, a fungi, a protozoa, or a prion. The characteristics that make the organism capable of causing disease include invasiveness, the ability of an organism to invade the host and cause damage. Pathogenicity, the ability of an organism to gain entry into the host and cause a disease. Virulence, the degree of pathogenicity. Infectious dose, the quantity of organism required to cause disease. Viability in a free state, the ability of the organism to survive outside the host. And ability to develop resistance to an antimicrobial agent. The only way to interrupt the transmission of a causative agent is to eliminate it. This can be done by prompting initiating the appropriate process, such as using aseptic technique to avoid cross-contamination, physically removing the contaminated substance through cleaning, and using effective disinfection and sterilization process. Number 2, reservoir or source. The second link is the reservoir or source of the agent, a place in which an infectious agent can survive. In the healthcare setting, the most common reservoirs are human sources, such as patients, healthcare personnel, family, and visitors. However, inanimate objects, fomites, such as environmental surfaces, surgical instruments, and devices, have also implicated, as have contaminated food, water, or intravenous fluids. Those with active infections but without obvious symptoms and those who are carriers represent the greatest risk to the other patients and healthcare workers because the presence of disease-producing organisms may go undetected. Definition: carrier. A person or organism infected with an infectious disease agent but displays no symptoms. Although unaffected by the disease themselves, carriers can transmit it to other people. Good personal hygiene and health habits, the use of appropriate housekeeping measures, and the proper cleaning, decontamination, disinfection, and sterilization of hospital equipment can eliminate reservoirs. Portal of exit. The third link in the portal is the portal of exit, or the path by which an infectious agent leaves the reservoir. Portals of exit associated with humans and animal reservoirs include respiratory tract, such as coughing and sneezing, genitourinary tract, such as urine, vaginal secretions, or semen, gastrointestinal tract, vomit or stools, skin mucous membrane, mucus or wound drainage, blood transfusions or contact with blood, and transplacental, through the placenta from mother to baby. Common ways CS technicians can block the portal of exit include covering nose, mouth when sneezing, coughing, disposing of facial tissues immediately after use, performing proper hand hygiene, hand washing, and disposing of trash and effectively using PPE. Mode of transmission. The fourth link is the mode of transmission, or how a pathogenic organism is spread. This can vary by the type of organism and by its route. Direct contact occurs when microorganisms are transferred directly from one affected person to another via blood or other blood-containing bodily fluids. Indirect contact occurs through a contaminated object or person, such as through inadequately cleaned or sterilized instruments, the hands of healthcare personnel, or contaminated PPE. Some infectious transmitted by contact include herpes simplex virus, the HSV virus, Staphylococcus aureus, respiratory syncytial virus, and Clostridium difficile. Droplet transmission is also a mode of transmission. Occurs when an infected person coughs, sneezes, or talks during procedures such as endotracheal intubation or suctioning. Infectious droplets can travel short distances to susceptible persons' mucous membranes of the eyes, nose, and mouth. Some of the diseases spread in this manner include influenza virus, group A streptococcus, adenovirus, and some types of meningitis. Airborne transmission occurs when very small droplet particles are dispersed in the air over long distances by air current and are then inhaled by susceptible individuals. Infectious agents transmitted by this route include Mycobacterium tuberculosis, or TB, spores of Aspergillus spp, and varicella zoster virus, chickenpox. Common vehicle transmission occurs when infectious agents are present in a vehicle such as food, salmonella, blood, HIV, or water, Pseudomonas. Vector-borne transmission rarely occurs in the U.S. hospitals. Agents can be carried on insects, on the feet or wings of flies, or by bites of insects or arthropods, mosquitoes, ticks, and fleas. Pathogenic transmission can be interrupted through proper hand hygiene, cleaning, decontamination, disinfection, and sterilization. Standard and isolation precautions, as well as proper food handling, proper water treatment, and proper maintenance of heating and air conditioning systems. Portal of entry, the fifth link. The fifth link is the portal of entry, or the path used by the infectious agent to enter a susceptible host. Patients are particularly vulnerable to transmission in areas where the use of defense mechanisms are bypassed. Portals of entry associated with a human host include respiratory tract, genitourinary tract, the urinary tract, and gastrointestinal tract, skin and mucous membranes, transplacental, and parenteral. Parenteral, something that is defined as something that is put inside the body but not swallowed. An injection or into the muscle is a good example of this. Safe protocols, including maintaining clean or sterile techniques during patient care procedures. This is the proper way to avoid portal of entry. Proper hand hygiene can alter access of infectious agent to a susceptible host. Other practices involve using only properly disinfected sterilizing equipment for invasive procedures and safe handling of disposing of sharps or needles. Note, caregivers and their patients rely on central sterile to provide medical devices that are safe from infectious microorganisms. Finally, susceptible host. Most of the factors that influence whether a person gets an infection are related to the sixth and final link, whether the individual is susceptible as a host and lacks the ability to resist infection. Some who are exposed to infectious agent will become severely ill and die, while others never develop symptoms at all. Some may progress from colonization to symptomatic disease right after exposure to the pathogen, while others will become temporarily or chronically colonized and never have a symptom. Colonization defined. Colonization occurs when microorganisms live on or in a host organism but do not invade tissue or cause damage. Whether or not an individual becomes susceptible to microorganism can be influenced by various factors. Age, very young or very old. Disease, history of underlying disease such as cancer, diabetes, or heart disease. Medications and treatments that can compromise immune systems, including chemotherapy, radiation, and steroids. And finally, trauma. The injury itself and the treatment of the injury can increase risk of infection. Some measures to boost the ability to fight disease include treating the primary disease, an example, keeping blood sugar under control, and diabetes, or administering vaccines such as pneumonia and influenza, and recognizing that patients are at high risk for infection. From a CS perspective, there are many opportunities to interrupt the chain of infection and play an important role in preventing and controlling infectious diseases. See example 16:18, which provides an example of how the chain of infection can be impacted by the CS department. Conclusion. Central service technicians face the ongoing challenge of ensuring that instruments and equipment they process are safe for patient use. Advances in technology and the emergence of new microbiological challenges have increased the difficulty in meeting this challenge. Every CS professional must appreciate the importance of infection control and prevention and thoroughly understand their role in this process. Terms to remember: biocidal, surgical site infection, or SIS, chain of infection, asepsis, asepsis technique, asepsis medical, asepsis surgical, hand hygiene, fomite, causative agent, reservoir, portal of exit, mode of transmission, portal of entry, susceptible host, carrier, parenteral, and colonization.